recently been asked to become what they call a volunteer ambassador for the Pituitary Foundation. And if you don't know, the Pituitary Foundation are based in Bristol, literally 2 minutes from where I live, which is quite strange. And obviously they are very proactive in the work that they do in raising pituitary awareness. So what I wanted to do is, I know most of you know about pituitary conditions, but it's just to really get across what the foundation does, how you can support, and what the other conditions are that may be of interest. Hold on a second, I've lost my notes, bear with me. So as we know, the pituitary is an important gland in the body and is often referred to as the master gland because it controls several of the other hormonal glands. It's situated behind the bridge of the nose and below the base of the brain. So symptoms can be many and varied, and they're often caused by this benign tumour growth. So the symptoms that the Pituitary Foundation are often presented with by patients who are unsure when they phone up, as you can see here: fatigue, headaches, change in vision, growth and weight gain, mood changes, and joint pain, which is probably something we can all associate with having been through. Pituitary conditions can affect anyone, male and female, of any background and any age. There is usually no cause as to why someone has a pituitary condition, and there is only a 1% chance of this being hereditary. The condition is lifelong, and symptoms can be bewildering. Many patients experience delays in being diagnosed in the condition, as the conditions are rare. So, what does the Pituitary Foundation want to achieve as a charity and as an organisation? So first of all, is they want to try and reduce the time to diagnosis. And I guess this is by offering a service such as their phone lines, and also a new text service that they've just introduced now. If people are unsure, they can talk to someone and try and get their diagnosis sorted. They want to try and improve people's quality of life. They want to reduce the sense of isolation. So again, somebody who feels that they may be alone, they want to offer support in helping people through that. And, probably one that we don't want to acknowledge, but they want to reduce any instances of death, or preventable instances of death. So, the pituitary, as we know, is the master gland, and there are various conditions that surround the pituitary, so we're just going to explore those quickly. So I love trying to find pictures that represent these. So that's my acromegaly picture. So caused, and I'm sure, I don't need to tell you this, but for those that are watching, caused by too much growth hormone. Symptoms include enlarged hands and feet, excessive sweating and oily skin, headaches, vision disturbances, tiredness, and potentially reduced fertility. We have Cushing's as well, caused by too much cortisol being produced. Symptoms can include behavioural changes, depression and mood swings, weight gain, muscle wasting, reduced fertility, and increase in hair growth on the face and body. Diabetes insipidus, which I think some of us experience whilst we have acromegaly. I know I did for a little bit. The hormone to control output of urine is not produced, which can cause a frequent need to pass urine, extreme thirst leading to excessive drinking, and an imbalance of electrolytes. Prolactinoma, which is one I'd not heard about until Sue Perkins, who you may know, had prolactinoma. Caused by too much prolactin being produced, symptoms can include reduced fertility, discharge from breasts, headaches, and visual disturbances. And then we have hypopituitarism. I can never say this one. Hypopituitarism. Means that one or more hormones aren't produced sufficiently. Symptoms may include excessive tiredness and decreased energy, muscle weakness, reduced body hair, weight gain, increased sensitivity to cold, low blood pressure, and dizziness and headaches. So it's quite interesting hearing those 4 or 5 conditions. There are crossover syndromes, I think, so diagnosis isn't always easy. But once diagnosis is reached, patients face treatment such as neurosurgery, radiotherapy, and possible lifelong hormone replacement treatment. Pituitary disorders can impact on a person's quality of life, and for some patients, their condition is lifelong and can have a debilitating effect. So we're all potentially on this long road of treatment and recovery. So what can the foundation offer? That's Menai, who's the chief executive. The Pituitary Foundation was founded in 1994 and became a registered charity in 1996, and is the only charity in the UK providing support for people affected by rare pituitary conditions. It is estimated that there are 70 to 80,000 pituitary patients in the United Kingdom. The Pituitary Foundation's vision statement is that every person affected by a pituitary condition has a timely diagnosis and access to the best treatment, information and support. And it has a number of unique services to try and do this. So, for example, there are a range of booklets that cover all of the different conditions that can be ordered on their website. There is a helpline. Does anyone use the Pituitary Foundation helpline? A few people have, okay. And I know there's an appeal going on at the moment for a second helpline nurse to try and fund that. And they've also just introduced a texting service as well. So that offers patient information, support. So there are local groups that meet up, organised and supported by the Pituitary Foundation. And there are also telephone buddies as well. And these are usually people that have been through our conditions and are there to talk to people to help them through their discovery and through their journey as well. There's the opportunity to meet. So this isn't an official pituitary engagement, but they have an annual pituitary conference, and I'll tell you a bit more about that at the end of this presentation. So there's also the opportunity to learn as well. So the website has plenty of information, and again there are booklets and cards that you can download too. So did you know that there has been a 27% increase of calls to the endocrine nurse helpline? So obviously the awareness is helping, and people are willing to get in touch to try and find out what's wrong with them. On the whole, patients talk to the nurse for about 20 minutes at a time. The website's had around 14,000 visitors each month. It's not just me. So it's a busy website. And, who's that? Is that you? There are about 5,000 publications distributed to patients and clinics every year. So the foundation campaign and provide a voice for the pituitary patient. They run a few different campaigns a year, take part in consultations and speak to public services such as GPs and ambulance services, politicians, other charities, businesses and the general public to try and raise awareness and understanding of pituitary conditions. So the question is, how can you get involved? There's a few different ways. Well, quite a lot of fundraising takes place. So people do crazy things like abseiling and the sort of cliff shoots and all that kind of stuff for anyone who's feeling brave enough. So fundraising is one way. There is the conference this year. So if you're interested in attending the Pituitary Conference, it's in Birmingham again. It's the 25th of November if you want to make a note. And there's going to be workshops and speakers covering a range of pituitary conditions. Perhaps the most important one is that you can become a member. So what this means is that you pay £25 a year. I think it's $35 for a couple. And that gives you access to the Pituitary Life magazine, discounts to events, and that money just helps support the foundation. So if you can see your way to doing that, that would be really appreciated. And that's it. If you want to get in touch, these are the numbers and emails. They're quite active on Facebook and Twitter as well. I've got a bit of a thing with feet. Thank you very much. Okay.